Welcome and good afternoon. Welcome to this afternoon's webinar on children's health and well-being during COVID-19. It's being brought to you by The Whole You. My name is Kathleen Farrell and I am Director of Work-Life Programs. I work in UW Human Resources and I am absolutely thrilled to be your host this afternoon. As always at the University of Washington, we are just incredibly fortunate to have a very deep resource pool of experts. And I'm sure many of you will share my opinion that I've never felt more grateful to be a Husky and to have the colleagues I have than I have during COVID-19. And this afternoon, we are very fortunate to have 4 colleagues from UW Medicine. 3 of them are faculty members in the School of Medicine and also clinicians at Seattle Children's Hospital. I'm going to ask each of them to just very briefly introduce themselves so you know who our experts are today. And then I'm going to step back and give a little bit of housekeeping to kind of help us understand how our time will flow. And then we'll do a deep dive into today's topic, really leaning on our experts and inviting all of you to ask your questions to make today's session as relevant as it possibly can be. Dr. Kostakis, would you be willing to start us out by just letting us know who you are?
Sure. My name is Dimitri Christakis. I'm a pediatrician and epidemiologist at the University of Washington, and I direct the Center for Child Health, Behavior, and Development at Seattle Children's Research Institute. My laboratory focuses on ways to optimize children's cognitive, social, and emotional development, and never has that been more challenging than it is today. I'm also the father of 2 children, a 22-year-old and a 19-year-old, both of whom have moved back home. So I guess I still have 2 children.
Thank you. Dr. Cronin.
Yeah, so my name is Matt Cronman. I'm an associate professor of pediatric infectious diseases at Children's. One of my roles, which is relevant for this talk today, is I'm the associate medical director of infection prevention. As a hobby, I study antimicrobial stewardship, sort of how to better use antibiotics, but that's not so relevant in the context of COVID. And I too am a parent. I have an 11-year-old daughter and a 10-year-old daughter, both here in their bedrooms at school as we speak.
Thank you. And Dr. Reed.
Hi, everyone. My name is Kendra Reed. I'm a clinical psychologist. As of tomorrow, I'll be an assistant professor at the University of Washington School of Medicine. And I'm at Seattle Children's. I'm the director of the mood and anxiety programs in outpatient psychiatry. And I specialize specifically in the assessment and treatment of youth with anxiety disorders and OCD.
Thank you all so much. And I think our participants can understand why we selected this group of colleagues and why we're so fortunate to have them. And we have one other colleague that I apologize, popped off my screen for a second there. Dr. Ann Browning, would you introduce yourself?
Sure. Hi, everybody. My name is Ann Browning. I'm an assistant dean for well-being within the School of Medicine. And I'm also home with a 4-year-old with an ear infection today. So if you hear background noise. For today, I'm going to be helping to navigate the chat and helping to forward questions to the panel. So you'll see me buzzing around on the chat, and please feel free to kick questions in there and I'll try and group them.
Great. Thank you all so much. I have very few words of housekeeping. The first, you may have already noticed that the session is being recorded today. We had an incredibly strong interest in this topic, and after today is done, we'll make sure the video is posted to the Whole You website. I think most of you are still muted. We ask that you stay muted throughout today's session. Thank you for that. It's also helpful if you turn off your video. It's just a little bit less distracting for others who are on the call. And chat-wise, typically, we want this to be a very participatory session. We do expect we will have several hundred people participating, and it's a little bit easier to manage that if we use the chat for you to ask your questions. If you're willing to put it out there for everyone, often other participants might be able to learn from what you've asked. And if you're not comfortable, you're welcome to direct your chat to Ann. And as she mentioned, she'll be looking for themes and pushing them onto the panel. And our panelists have very graciously offered to help us after today's session. If we don't get to all of your questions, we will do a follow-up and send you some information via email after today is done. Let's get down to it. So each of our panelists has prepared just a little bit of a deeper dive of information to help you understand who they are, what their expertise is, and orient you a little bit to what they're already working with related to COVID-19 and hearing from parents and children. So Dr. Reed, you were the last person to introduce yourself. Would you be the first one to tell us a little bit more about your work and get today started?
Absolutely, happy to. So as I mentioned before, my primary area of expertise is in anxiety and obsessive compulsive disorder. And anxiety is a funny topic to think about in the middle of a situation like this because we expect it during a crisis like a worldwide pandemic. What I always explain to the families that I work with is that anxiety is a totally normal, helpful, adaptive feeling. It's your body's natural alarm system that alerts you to threats. So if anxiety is coming up for you and your family in the middle of a worldwide pandemic, of course it is. There are a lot of real threats or things that feel very threatening, and a very strong uptick in uncertainty and perceived loss of control at a time like this. So even though anxiety is helpful and typical, it can become problematic when it becomes too big for the situation, or you become so distressed or interfere so much in your life that you can't do what you need to do or want to do. And what I would want everyone to know is that the key component of evidence-based intervention for anxiety involves facing one's fear or doing exposures. So in the middle of a worldwide pandemic, we get a lot of questions about, well, what does it mean to face your fears in a way that feels really safe? So as we talk about what our interventions are for anxiety in a situation like this, we really want to think about context. And this goes for both youth and adults alike. We want to think about the difference between objective and subjective risk or threat. And so that's just one piece that we'd want to tease apart. And I would be remiss if I didn't mention that objective risks are different for different communities. And we really need to consider that specific context when considering how to address anxiety or other mental health concerns related to COVID-19. Especially given that we know that COVID-19 has disproportionately disrupted the objective safety and stability of communities of color in particular, and that includes housing, employment, food insecurity, let alone those direct health risks. We also know that mental health consequences may be more common for youth of color, and we already know that they face greater barriers to treatment. So just wanted to mention those contextual things just as we think of them as a framework as we think through our questions today. And in terms of considering that piece of objective versus subjective threat, we want to think through kind of a decision tree about, whether or not a fear is realistic or not. For some of the communities that we work with or who are affected by COVID-19, the fears that they are considering are very realistic. For others, the fears are not as realistic. And so the approach may be different. For fears that are realistic and it's not a situation that youth should have to learn how to deal with, then it makes sense to avoid a situation like that. But if fears are realistic or unrealistic, and a youth should learn how to deal with a situation like that, then we're going to be talking about safe ways to approach that situation, maybe building in some additional problem solving, skill building, or other changes to a plan in order to help youth increase their self-efficacy or feeling that they can cope in a situation like that. So I know I said a whole bunch there, but just the highlights of what I really want people to think about in a situation like this.
Thank you so much. And for folks who are joining us a little bit late, so you know where we are, each of our panelists are just giving a little bit deeper overview about who they are, their area of expertise, and some initial thoughts about their experience working with children and families during COVID. Please use the chat to ask your questions. We'll do these, kind of shallow, deeper dives of introductions. We'll go through them all first, and then we'll dive into the Q&A. So Dr. Croman, would you be willing to pick up next?
Of course. I thought I would start actually just talking about the overview of this pandemic. So let's go over these staggering numbers. 29 million infections worldwide, almost a million deaths, 900,000. In the United States, 6.5 million infections, 190,000 deaths. Here in Washington, 80,000 cases, 2,000 deaths. And then in Washington over the last few days, the rolling average has been around 380 cases per day. And here in King County, it's about 90 cases per day. So that's what's out there. I think in order to frame some of the future answers we may have to questions, it's important to just detail a few more things that we know about this virus. So this is a coronavirus. It's an RNA virus. The main way we think this virus is spread is by the respiratory droplet route. And that's where this whole 6 feet of separation thing comes from. These respiratory droplets are smaller molecules of water that are heavy enough to fall out of the air after a few feet from someone who's coughed or sneezed or been singing. And masks really are meant to protect other people from us if I'm the one wearing the mask, so that my respiratory droplets are contained. Of course, with healthcare workers and depending on the quality and fit of the mask, it can protect the mask wearer as well. But in thinking about the pros and cons of masks, as a parent, part of the pro of having your child have a mask on is to kind of demonstrate that we're participating in this social contract of trying to stop the spread of this pandemic and stop the spread here in the United States and here in Washington. I think there have been a number of misperceptions out there, probably none of which anyone here buys into in terms of whether children can get this infection, whether they can spread it. They can get it, they can spread it. There's still lots we need to know to better understand their role in this pandemic. There was a report from the Centers for Disease Control and Prevention today that came out about children who died. So I can go over that if there's questions about that. And, I guess I'll also just highlight very quickly right now the importance of testing, including testing those who are asymptomatic so that we can understand where we are with the pandemic here locally now and as we move into the future, as well as the importance of getting a flu shot. We should all get a flu shot. All of our children over 6 months should get a flu shot so that we don't have to deal with the pandemic of coronavirus and influenza on top of that once it gets to be influenza season. But happy to answer other questions about the virus itself. Anything else I can help with?
Fantastic. Thank you so much for that bit of background. And I just wanted, someone has shared with me in the chat that something I said early on is incorrect. You cannot directly chat with Anne. I apologize for that. And I think that is unfortunately something I cannot fix for us without risking doing something horribly wrong for everyone. And so if you aren't comfortable putting your question in the chat to everyone, please send it to me directly and I will do my best to monitor those as we go along. Dr. Christakis, would you please jump in?
Sure, there's a lot to say, and I really want to get to your questions. I want to start by one of the most common questions, one of the most significant concerns parents have, which is, what is the direct medical risk if your child gets COVID? And Dr. Krollman can speak to this probably better than I can, but I think it's important to put that risk in perspective. So that I would say that the most conservative, which is to say the worst case scenario is that if your child does get COVID, there's less than a 1 in 5,000 chance that they will die from it. Obviously, that's a horrible situation that we all would worry about, but I want to put that risk in perspective. Your child's risk of being struck by lightning in their lifetime is about 1 in 10 to 1 in 15,000. And most of us don't lose sleep over that. That doesn't mean that your child is not contagious and doesn't pose risk to you or to other members of your family, which is a secondary and very real concern. But I think the real reason I'm here is to talk about children's cognitive, social, and emotional development, since that's what my lab focuses on, and I think probably a lot of you are worried about. So I'll speak briefly about the cognitive and the social part, because I think Dr. Reed can speak to the emotional, and she already spoke about part of that. All of you now, regrettably, or most of you, I should say, because some of your kids, very few of them, are actually in school. And so you're probably concerned, rightly, about what the impact of this pandemic is going to be on their cognitive development, because we're all of a sudden thrust into a world of distance learning that we were not prepared for, our kids were not prepared for, and quite frankly, most schools and teachers weren't prepared for. We're kind of in the midst of a large national experiment on what distance learning can offer our children. And it's important to recognize that we speak about children, or we speak about schools very monolithically, as if all children are the same and all schools are the same. All children are not the same. Kindergartners are very different than high school seniors. And if you have a primary school child, the truth of the matter is that distance learning doesn't really work very well for them. You don't need an expert to tell you that. You probably know it yourselves. They're going to need a lot of hand-holding, a lot of in-person instruction in order to maximize their learning. I think for many parents that's stressful. We're not prepared to be teachers. We didn't train to be teachers. We may not even have the time to be teachers. And I think you need to give yourself a break, not be too worried about fulfilling all of your children's cognitive needs. But know that you are going to have to play some role. I think if your children are older, if they're in middle school or high school, they can adapt. Most of them can to a distance learning environment. It's not going to work perfectly. It's not going to work for all of them, particularly if they have any kind of special educational needs. And again, in those situations, you're going to have to play some kind of a bridging role. I'm sure I'll have specific questions about that. And the other thing I want to talk about is children's emotional development, because as important as children is for children's cognitive development, it's equally, if not more important for their social emotional development. Kids need to be around other children. We all need it, but most of us can adapt, at least in the short term. And I want to encourage you to find ways and to allow your children to safely be with other children. And I'm sure Dr. Kronman will have ideas about how to do that. But I no longer ascribe to the idea that we have to keep our children socially isolated for the remainder of this pandemic. I think we're going to do, frankly, too much damage if we keep them away from other kids for realistically what's going to be at least a year. It may be a year and a half. I am not optimistic that school will go back in January. I'm not even sure it'll go back the way we all think of it as normal, even next September. So briefly, I'm a big proponent of pods, and we can talk more about what pods are and how to make them work for your family. But the general idea is to find safe ways with families or other children that you can trust that will adapt to your criteria for maintaining safe ways of being together, and to try to find opportunities to allow your children to socially engage. I was going to say outside is best while the weather is nice. And lo and behold, when we thought 2020 couldn't get worse, now we have the smoke to deal with. So I'll stop there, and I'm happy to let everybody else take questions.
Thanks to all three of you for giving us that helpful overview. And there are a lot of questions coming in. And I think it was really helpful to end on that note of social isolation, because there's a lot of questions about that. I also will say, when you said 18 months from now, I imagine the anxiety level of some of the parents who are on today's call also escalated too. And I think throughout this, as we talk about the implications for children, recognizing that all of the work and anxiety that our parents are feeling as well, I hope that you all feel like you can jump in and speak to a little bit. But on social isolation, I think there's a lot of questions around what are the risks, particularly for children of different ages, of this kind of ongoing experience of not being around peers, not being around family members. Can you kind of elaborate that, any of the three of you?
Kendra probably knows more about this than I do. I can just speak as an epidemiologist. What we've seen is an increase in children's depression and anxiety. We saw it first in China with studies coming out from there. We've seen it in Europe, and now we're seeing it in the United States. I think it's a mixture of their concerns about their own safety, and of course, many of them may have actually firsthand or secondhand experienced direct loss of family members, so their fears are not unfounded. But there's also the effects of social isolation, as I said. I mean, we're essentially cutting off relationships that are essential to children's well-being, to their emotional development. And I should also point out that pre-pandemic, many of us, myself included, because I study screen time, were concerned about the fact that children didn't have enough real interaction with their peers, that all of their interactions were mediated through social media. And in this period of 6 short months, we've gone from being concerned about that, about the over-reliance on social media as a way of interacting with peers, to basically restricting children to that mode of interaction. And there are a lot of reasons that can be unhealthy.
Yeah, I'll just jump in here and I just want to echo those thoughts about the increase in depression and anxiety for youth as a direct impact of social isolation. Particularly, I mean, we're seeing it across all age groups, you know, we, particularly for teenagers, are concerned about depression, just mounting, you know, some groups are experiencing increases in suicidal ideation and things like that. So these are just things that I would encourage families to have open communication about. I saw a couple of questions. I just quickly perused the chat about, you know, how can I, you know, broach these topics with my children without making them feel afraid or without, you know, inducing some other emotional state. And I just want to say, that it's okay to talk about feelings with your kids. It is normal to experience anxiety. It is normal to experience sadness. And the more that we can, as adults, as caregivers, model a discussion about these things, the less we're stigmatizing those emotions if our kids are experiencing them. So I would encourage families to approach a conversation about this regularly with their kids. It's like, hey, there have been a lot of changes. How are you feeling about this? Even normalizing, like, it's okay if you feel good about not having to go to school. It's okay if you feel really sad about not being able to see your friends. There's no right way to feel. There's no wrong way to feel. And just allowing for the scope of emotional reaction so that you can check in and open up a conversation about that. Now, how this conversation looks obviously depends on the age and developmental level of your child. I have a 21-month-old daughter at home. So my conversations with my daughter are going to look very different than the other panelists' discussions with their children around these topics. But you are the expert in your child. You know how to communicate with them the best. I would just encourage you to have these conversations.
If I can, I just was going to jump in on 2 quick topics. One, Dr. Reed talked about modeling, and I think I've been so impressed seeing parents model not only discussing their feelings, their anxieties, what have you, but also all of the other somewhat mundane things we have to do. Wearing a mask, washing our hands, you know, encouraging their 2-year-olds to wear a mask. It's mind-blowing to be able to get a 2-year-old to do anything. So I've just been really impressed with that. And then I just wanted to toss out there how I think about pods as we talk about social isolation. Because I agree with Dr. Christakis, I agree with Dr. Reed. I think the more interaction we can have, the better. There's no one size fits all when we think about pods. I think each family has to look at what are the risk factors for the members of our family. What is our risk tolerance? Is grandma who is 85 always coming over to provide childcare 3 days a week, and could we be putting her at risk? And so you kind of think about your family risk factors. You can think about the risk factors of the other people in the pod that you'd be creating. You have to have an honest discussion with them about your risks and your risk tolerance. And then ideally look at the local data to try and better understand, what is the pandemic doing right now? Are we seeing more cases? Are we seeing fewer? You know, are the members of the pod folks who can comply with hand washing and mask wearing if they're up, you know, above the age of 2, or are they so young that they can't do that? And you kind of filter all of that into your own personal calculus about whether being in that pod is going to increase your risk of the infection or not. But certainly being in the pod is going to decrease some of these anxieties and help you retain your sanity through the long haul, because it's not going to be a short marathon, unfortunately.
Yeah, just one last point. I mean, you know, Jim Stockdale, I think it was, the first name was Jim, who was the vice presidential candidate of Ross Perot. Most people may remember him from that. He actually was in the Hanoi Hilton, and he in Vietnam, and he had what he called the Stockman doctrine, I think it was called, which was apparently very helpful at getting people through it. And what it was that he had 2 points. One was to acknowledge the harsh reality of the present, how bad it is today. And I think Dr. Reed and Dr. Crummett both emphasized, there's no reason to misrepresent the situation we're in, but it's equally important, as he did, to say, we will get through this. And all of us know it's just a matter of time before we do go back. And you should know that for yourself, because your children's anxiety will reflect your own anxiety. So it's important that you all know that all of us believe we will get beyond this. I'm optimistic we'll start to get beyond it in the new year, which is to say, I think there will be a vaccine in early 2021, but it's going to take a while before that's widely disseminated and effective. We will get through this, and you should communicate that to your children, both by your own actions and to the extent they're able to understand it themselves and process it cognitively. This is not here forever.
There's a few questions, and I've seen a little of this in the chat. I apologize. And there's also some folks submitted questions ahead of time via a Google form. And I think there's a concern that a few parents have voiced that in their conversations with children about safety, their children may have taken a little bit too much to heart. Like they've had honest questions and they've coached them through why it's important to wear a mask, but now their child is almost, even when they have the opportunity to be around others, they don't want to, because they've gotten this message around, you know, yes, we can be careful, but there's a danger out there. So can you talk a little bit about that? No matter how well you try to communicate, the way your child interprets that message you may have to undo something and step that back.
I'm so sorry, my internet is super unstable right now, so I missed that entire question.
Yeah, it was a question about parents who do such a great job about helping their children understand they need to be safe because there is something out there to be concerned about, but the child is demonstrating such fear that they can't get past it. You know, they know that there's a danger. They've been told there's a danger. We have to be safe. And now they're just afraid to leave their home or to engage with peers or family members.
This is a perfect example of what I was talking about at the beginning of, like, there can be real threats and anxiety can grow to be too big for the situation. So I see a lot of youth who are afraid to even go in the backyard because of COVID. I mean, wildfires aside, because they're afraid that they're going to contract COVID even though there's nobody else around. And so I think in these situations, the key piece is to focus on behavior. That's a key thing across all ages. So thinking about, like, finding ways that we can start to approach things that we know are very low risk, or where the anxiety is far overblown for the situation. So let's practice some brave steps of going out into the situation. And I just want to mention what Dr. Christakis said a few minutes ago is so key. When we think about supportive parenting for youth with anxiety, we think about the combination of two key factors. One is validation. So I get that this is hard. And the other is confidence that they can do it. So this is hard, and I know you can do hard things. I think a lot of the times we feel pretty unsure because our kids feel so little. Can they do hard things? And we just want to reflect the confidence that, like, they can do hard things. We can practice going out into the backyard, taking a walk around the block, you know, where the risk is quite low, even though we feel afraid in that moment. So we don't wait until we're not scared to practice brave steps. We do that in spite of the feeling of anxiety. And that's how we retrain that alarm system to say, hey, you're kind of going off when I don't really need you right now, right? Having a lot of open communication and parents modeling and being really aware of what they model with their own behaviors, what they model with what they say outright, with their language, with their words, and with their nonverbal expression. So if you're like, yeah, go in the backyard, it's gonna be fine, kids are gonna get a really different picture. And I think this is really important to point out because this is a time when so many parents are feeling incredibly stressed. you know, the uncertainty is overwhelming in so many different areas that we may be having, you know, different expressions or behaving in different ways for things that we're thinking about in our head, but our kids are interpreting it differently. Like, oh, mom looks like you know, she looks really nervous. Maybe I shouldn't go walk over here or go outside or what have you. So I think we really need to like focus on behavior, what we're modeling, and setting some brave steps with rewards for doing things that are hard.
I would just add one thing at the risk of sounding like a Pollyanna. Last January, I finished reading a book called How to Raise an Adult, which if any of you have read, hopefully you enjoyed as much as I did. And really one of the main points of that book was we need to give our kids more homework to do, you know, more chores, meaning chores at home, give them more responsibility. And I think like Dr. Reed is saying, we can both show our children that they can do hard things, and we can begin to build up some of these other skills for them. Because if any of you feel like me, there's just more to do right now, and we're all stuck at home together, and there's a dog to walk and dishes to do, and I've got to try and make this Zoom meeting right now and have it be quiet, and I need help with that. And I'm very lucky. 10 and 11 is a great age, and they certainly can step up and do some of these chores. But even 3 and 4-year-olds, they could pick up toys, right? They can do small tasks. And then that's a demonstration that they can do these hard things. And, you know, you can find some positive rewards in that, so.
Thank you. And I see there's some other questions in some other categories that we're going to pivot to in a moment. But there's a couple of colleagues who have asked questions about their children who they know have experienced suicidal ideation in the past. And there's just, you know, that is one thread that has not come up yet, and a real concern about how do we talk about some of these difficult topics with children who were just concerned about further increasing anxiety or depression.
Well, I guess I would just remind our audience of something I said just a little bit earlier, which is just kind of the invitation to have these conversations with your kids. I think a lot of times parents shy away from conversations because they're worried about, like, oh, if I ask about fear, they're going to feel scared. If I ask about suicidal ideation, then they're going to have it, right? That I'm going to put ideas in their head. And what we know from the research is that just really doesn't pan out. And instead, we learn more about things that we should know about our kids through having those conversations than we do any damage. I think it's important for parents, especially if there's a history of suicidal ideation, to check in about these things, to say, hey, I know that this happened for you before, that you had some thoughts before about not wanting to be alive, or about wanting to kill yourself, or about wanting to hurt yourself, even though you didn't want to kill yourself. Are you having any of those thoughts right now? Are there ways that we can make sure that we get you some support? So I just really want to emphasize the importance of having that conversation, and then reaching out to, you know, your child's primary care provider, the Washington State Mental Health Referral Service, and any other providers within your network that you can connect to for support.
Thank you. Does anyone else want to add to that, or?
I guess I would also add, just if there are true safety concerns, making sure that you contact real urgent resources like the emergency room or things like that, and make sure you plan for safety around that.
Okay. Thank you. And there were several questions, again, some specific about children who have expressed an interest in self-harm or suicidal ideation, but then also just generally concern about talking about anxiety, raising anxiety. And I think the takeaway I hear from you is it's okay to go there. It's not only okay, it's actually a good thing to do. You're not planting a seed, you're not planting an idea, just be open and honest.
Right.
Great.
And again, anxiety is a normal feeling we all have. So it's important to validate that that's an experience. Like, everybody on this call has experienced anxiety about something in their life, because it is a human emotion, and it's okay. It's not a bad thing. It's not something that we cure or make go away. People would be at the hospital for a different reason if that was the case. They would have walked into traffic or something. So anxiety is not a bad thing. It's okay.
I just want to add one point, and I agree totally with Dr. Reed. I think that your natural parental instinct when you hear your child being anxious is to dismiss the anxiety, to try to reassure them that they don't need to worry about that. That's not the right initial response. It's so natural to feel that way because you feel like it's the best thing you can do for your child. You don't need to worry about this. It's not going to happen to you. That doesn't help. The most important thing you can do is start by validating that their anxiety is real to them and you understand it and you feel it, because they need to hear that.
Thank you. I'm going to pivot to a different thread of question, and that was for parents who may be sending their children to childcare or to youth programs. How do they assess the safety and how that environment is contributing to their child's well-being at this time?
I'll start out with the virus part of that answer, which is bearing in mind everything we've already talked about. We also need to think about what are the elements of that equation in terms of the child care center. How many people are there? What are their practices in terms of, does the teacher rotate from class to class, or is it just one teacher with that set of 8 or 10 kids in the child care center or classroom? Can they limit the number of interactions? Do they have protocols for screening? If they identify a positive, do they have a protocol in place for letting other people know and making sure that they get tested? What are their cleaning practices? So I think thinking about those factors can help a parent assess how much they're doing to try and mitigate the spread of this infection.
Yeah, I would say you should start by observing their practices, just as Dr. Clement said. And from my perspective, and he can correct me, there are the three most important things that we know based on very sound scientific evidence works are masking. So is everyone wearing a mask? Is the teacher wearing a mask? Are most of the students wearing a mask? Second, hand hygiene. Are people regularly washing their hands? And watch and see, are the students washing their hands? Are the teachers washing their hands? And the third, I think that's the most challenging, is the issue of social distancing, because in fact, social distancing in childcare or in schools, the 6 feet rule that we all know is very difficult to achieve. But there's something magical about 6 feet. As much distance as you can maintain is good. And the final thing that doesn't have a strong evidence base that we've talked a lot about, that I think has a very strong theoretical basis for working, is this notion of potting. So just what Dr. Kroman said, how many kids are your kid going to be exposed to? How many kids are other teachers going to be exposed to? It's best to have whatever number it is, only be exposed to that, because it minimizes your child's risk of infection. And if there is an infection in the school, it minimizes the risk that everybody in the school gets it. It can be contained within one classroom or one room.
Those are absolutely spot on. Totally agree. And then there's a few comments in the chat, which I'll just address right now, which are, we haven't been allowed to observe that childcare center or classroom because they're trying to limit people coming and going, which makes perfect sense. We live in a world in which every one of us is carrying a video camera or a camera, and I'm certain that folks could either share their practices in a written way with you or send a photo of how they're setting up their classroom or their childcare center, describe the practices that they're taking. So even if you can't directly observe it, I guess, hopefully they will give you some indication of the steps that they're taking to try and decrease the spread of the infection. And secondly, if we're physically distancing, do we need to get the flu vaccine? Yes, please get the flu vaccine. Absolutely, everybody 6 months of age and up. It's quick and easy. I got mine at Bartell's a weekend or two ago. Please do it.
And there, there's an anticipated shortage of flu vaccines, so I would not postpone it. I would get it sooner rather than later.
Thank you. And I also included a link in the chat. There is a website that we've been maintaining as a university. So it has the most recent guidance from King County Public Health, the State Department of Health, and some questions that you may want to ask your childcare provider or your youth program provider. And that includes, what is the recommended number of children per classroom? That information is in that resource. So we'll also include that when we send follow-up to today's event. Farther up in the chat, there are some additional questions about technology. And I think earlier there was some comments about, we've encouraged kids to stay off of technology and be more physically present, with who they are with in the room at the time. And now there is such a strong leaning on technology, both for schooling and socialization. And I think what I saw in some of those questions was for children of different developmental ages, what are some different ways to be thinking about how much is too much, how to have conversations again about technology use?
That's a very complicated question. Frankly, I've done entire webinars on just that because I can't address it for all kids in all ages. But I want to emphasize that that your children are not going to get everything they need just from a screen. And the truth is, most teachers are using screens the way they would, are teaching to a screen the way they would try to teach to a class. And it doesn't work. It takes a three-dimensional reality and turns it into the most boring television program one could ever have, right? What makes a classroom work is that a teacher can interact with individual students, that she or he can walk around the room, that they can look in their children's eyes and see who's getting it, who's not getting it, who's engaged, who's not engaged, who needs additional materials, additional encouragement. You have to provide that in the room. And what that might mean is that you actually take your child offline once you understand what they're supposed to be getting out of today, if they're primary school children, and try to teach those skills on your own. Maybe not using the exact techniques that a teacher would use, but with the same goal in mind. I want to emphasize that you should really make a point of keeping your children off screens for at least, pre-pandemic, I used to tell parents that they need to have at least 3 hours, at a minimum of 3 hours of non-screen time out of school during the day, which would be during meals, an hour before bed, and then 1 hour after school during some kind of an activity, whether it's a sport or a hobby or a club. You need to do even more than that now because they're spending so much time on screens as part of their schooling. So build that into your child's day. One of the things that's lacking now is sort of a structure and a routine, and kids need that as well, and you need it. So if you're trying to work at home and your child has school, try to set up routines. It may not be the same routine every day. It might be that Monday, Tuesday, Wednesday, Thursday, Friday, there's a different schedule for when they're in school and you're working, when you're with them and you're all offline, when you're outdoors. Make yourself schedules. I can't possibly tell you what that schedule will look like, but I think it's immensely important that you have that routine and that you yourself are physically present, authentically present during that screen-free time. So if you, because of your own needs, have to have your child in front of a recreational screen for some time so that you can do your work, make sure that when that is done, you put away your screen and you spend 1 hour with them without a phone even in sight. Ideally outdoors while you can be outdoors, well, when you can be outdoors again safely, but even indoors, that you're fully engaged with them and not distracted at all.
I just want to add, just to add on to the importance of structure and routine. One of the things that is hardest, certainly not the hardest, but a really hard piece about this pandemic is the uncertainty that we're all experiencing. And for sure, for our children who have had their entire lives upended, there was some internet meme that was like, my 6-year-old was really tough. And then I realized that one day we just picked him up from school and he never saw his friends again. And so I think about that a lot and how routine can mitigate some of the effects of uncertainty. There are some things that our kids can rely on happening even if it's within the day, if it has to change day to day. There are things that they're like, okay, I know that there's going to be a break at this time, or I know at dinner there are going to be no phones, I'm going to have my parents' attention. So I think that's really key in mitigating some of that uncertainty that we're all experiencing.
There's a question in the chat that I think I hear multiple times every day, and it picks up on this theme. For parents who are working from home and their children are interrupting them when they're doing work, what is the right thing to do? There's a lot of guilt to saying, no, I can't help you right now. And yet I'm also hearing there's some, that's okay. So can you help think that through a little bit for folks that are participating?
Yeah, I mean, I think, again, all of this, one of the challenges of being a pediatrician or a pediatric psychologist is that, we get asked about children and, that's everything from a 1-month-old to an 18-year-old. And then obviously children that have different developmental challenges. So when your child is interrupting you, if it's an infant, they absolutely need your attention. That's just the reality of this pandemic. And I have been on many Zoom calls where parents are bouncing a baby on their lap, or I've been on one where a mother was breastfeeding. I mean, these are just the times we're in. I think if your child is old enough to understand limits, and I agree with what Dr. Kronman said about, like, we infantilize our children today much more than we need to. Those limits are perfectly reasonable. But it's back to what Kendra and I were saying before. They can understand a structure that mom is going to be uninterruptible between this time and that time, assuming they're old enough to understand that. And then after that, we will have lunch, or we will go out, or we will play this game for this period of time. I think it's really important to set those expectations, because otherwise it is a little bit challenging, if not unfair to your children, for them not to know at all during a day when you're available to them emotionally or physically. When are they going to eat? when is lunch?
I just want to add to that. I 100% agree. And I think, all of your kids, I imagine, are different developmental ages and stages. And so I just want to think about, like, as you set that goal for, mom or dad or whatever caregiver is not going to be available for, we're going to work independently for this next chunk of time, whatever it is, or until this timer goes off. We want to set initial goals that we think our child could achieve, even if that means that you're in the middle of a meeting and you mute just to say, you did it. Okay, another 5 minutes. Because we want to catch them being good. We want to catch them doing what we want them doing, even if that means we're interrupting ourselves just a little bit, so that we can positively reinforce that, and make them feel like, okay, I'm doing it. I'm doing a good job. So we can even set rewards around that if we need to. But I think the key thing is a lot of positive reinforcement for when they're doing the thing that we need to see them practicing. And so that means starting with some time frames that whatever their age they can be successful in reaching, and then expanding from there.
And I just was going to add one thing. In the chat, Dr. Browning responded and said, give yourself a lot of grace. And I think we cannot bold, underline, italicize, and put asterisks around that enough. None of us have lived through anything like this before. We have no precedent for this in our life. And that idea of giving yourself a lot of grace goes for how we accomplish our work. What we're wearing in meetings, getting your 2-year-old to wear a mask or not. We have all of these thoughts about, I should do this, or I'm a bad parent if I did that. And we just have to try and avoid those thoughts. My wife calls that shoulding all over yourself. You don't should all over yourself. And so just give yourself the grace. This looks different than anything we've ever seen before. And I think everybody gets it. And if they don't get it, they should.
Yes. And I think we are all parents on this panel. And I would say all of us are dealing with different developmental ages, and all of our kids, I'm sure, have, like, my daughter's been present with me on patient meetings, on, crawling over my back and in like leadership meetings. It is an inevitability of the time. And not one person has ever complained or heard her screaming as I try to change a diaper in the middle of a meeting. It's just real life. And I think we're just extending that grace to each other as much as we can.
Hear, hear. We have a question. It's a little bit different flavor and for a different age group. And it's about not all parents are at home working right now. Some parents are teeing their children up to maybe be home and unsupervised for the first time. And so it's kind of a general question about the potential impacts on those children who are home alone because both parents are working. And I think there's also a question about how do I know if my child is ready for this, and how do I equip them to take on that responsibility?
Yeah, it's a really good question. I think a couple of points on that. I think that is the reality for some families. It's a real luxury to be able to be at home, and we've been speaking as if that's an option for everyone. It clearly is not. I think it's incredibly important to check in with your children on a regular basis. And again, you can schedule those times around what their availability is, depending on their school schedule. I think to the extent that you're able to do it, you can try to ease your child into that schedule of being home alone entirely. So don't necessarily go from always home with them to always away from them. If you can stage it, if you can shift your work hours at all so they're not alone for large chunks of time. And here's another opportunity to consider potting. So again, I don't have school-age children, but if I did, I would give serious consideration to finding other families where there could be another responsible adult, either in the neighborhood or even maybe even in the same household, if that works for you, where somebody else is present. Because the truth is that children don't stop needing the presence of adults as much as they think they do in middle and high school. They really do need responsible adults available to them. And you need to know that there's a responsible adult available to your child. So I think we all have to be very innovative and creative about ways to meet our children's needs. And I'm continuously impressed by the innovation of parents in terms of coming up with creative solutions. So I really do encourage you to think outside of the box and as best you can. And if there really know all their alternatives, then please make yourself available to your child at least on an as needed basis. So if they don't have a phone to call you, you should absolutely get one. And if you have a phone, you should make sure that it's always available to your child to reach you.
There's also some questions in the chat, again, about younger children, and some of them are around infants that were born during COVID, who, again, are having very little interaction with adults outside of parents during this time, and then also toddlers, just their kind of social development. And so I know we've talked a little bit about that, but I wonder if there's additional advice about how to mitigate any potential issues of having really young children who are developing their socialization and ability to be with others during this unusual time.
Yeah, I mean, I think I touched on this earlier. I think for youngest children, parents can actually take care of their cognitive needs quite well. So your baby is going to develop perfectly well just through your interactions with them, by your talking to them, singing to them, reading to them, playing to them. That's all they need from a cognitive standpoint. But as they get older, really even from 6 months on, they crave other human contact. Most of you who have babies realize that even a 4 or 6 month old will fixate on another infant. They recognize other babies as like them, and they want to engage with them. I would not encourage you to deprive them of that. It's really important for them to get it. Now, the nice thing about little 6 month olds is that you can put them in a room with other babies 6 feet apart and allow them to cackle and gaggle and smile and parallel play. As they get older, it's going to be a challenge because they're going to want to get into their other babies, other toddlers' face. And, I think this gets back to what Dr. Kronman Matt was saying about like your tolerance for risk. You can watch them engage. You can make sure you wash their hands. You can make sure that the child they're playing with doesn't have other symptoms. You can make sure that the family of that toddler themselves is very responsible about who's in their house, how careful they are about bringing the virus in. Again, I mentioned I'm an epidemiologist, and numbers give me comfort, but I'm a bit of a geek. But you should know that the prevalence of COVID in our community, which is to say in King County, is less than 2%. So it's not as if, even though we should treat everybody as if they're infected, 98% of people are not. Really, more than 98% of people do not have it. And children who get it overwhelmingly don't suffer serious consequences. So I don't think we should be cavalier about the risks. I think the real, very important public health reasons to take it seriously, but there are also risks of us being complete shut-ins, particularly for young children. And these risks and benefits have to be balanced at an individual level.
Okay. We are coming up on the end of our time together, and there's been a couple of questions about next steps in the chat. And I want to say we will be sending the link to this recording to everybody who registered for the event. We'll be putting it on the Whole U website. We'll also be taking today's chat and just looking for kind of the themes of questions. And if there's any we've missed, we'll make sure that we send out all of those as well. And I'm looking at Anne, who's done an amazing job of monitoring the chat and sending me questions. Anne, would you like to have the last word or the last question? Is there something we've missed?
Thanks, and here we are. So one question that Sarah raised, I'm actually looking at it. I just want to make sure that we had it answered because I know a number of you brought it up. How do we inquire about whether our child is experiencing anxiety or fear without giving them the idea that there's something that they should fear? So I want to kick that back to the group and just make sure we felt like we answered that since so many folks kind of resonated with that question.
Absolutely. So again, I think I would just say that, you know, anxiety is not a bad thing. I think the fear of fear is more problematic than fear itself, at the risk of sounding really trite there. But I think it's really important for parents to have the conversation because we are all going to experience anxiety and fear in our lifetime because we are human. And sometimes we will experience that for very real things. Sometimes we will experience that for typical things, but it's not as scary as we think it is, like taking the SATs or like our first day of college or something like that. And sometimes we will experience anxiety that is far overblown for the situation. And so any way this goes for your kid, it's important to open up the dialogue so that we reduce the stigma of anxiety, because the more they hide it and keep it inside, that's the bigger problem there.
Thank you. And I would just add, having looked at the chat a little bit, man, just to echo what other panelists have said, just recognize how hard this moment is. And, you know, the more we mentioned giving yourself grace, just recognizing this is a little bit crazy. And I think once we allow ourselves to realize that this is a different moment, the way we're going to be working is different, the way in which we're interacting with our kids is different, to the extent that we can just recognize your own reactivity. I feel like my fuse has been so short, given kind of the chronic stress that we've been under. And once you allow yourself to recognize, like, wow, that was a quick response. Can I try and give myself, you know, a bit more time before I react to my kiddo? Can I recognize those patterns and try and disrupt them a bit? But man, this is tough. And just allowing yourself to kind of normalize your own experience of the hardness of this moment. I hope that can be a bit helpful. You don't have to be perfect.
Thank you. We are at our time. Thank you so much to everybody who has participated in the chat, who made time to be here, certainly to our panelists. Thank you to the Whole U for making these events possible. There are several coming up. Actually, there'll be wonderful opportunities for parents to take an hour to engage in some self-care and self-support, and we'll be sure to include those when we send information out as well. And so thank you, Leighton, for being here with us, reminding us why this all matters. Okay, take good care, everyone, and hopefully we'll see you at another webinar soon.